I'm Gina Duncan with Equality Florida. I'm Equality Florida's statewide director of transgender equality, and I'm so pleased to welcome you to the first of many in a series of our LGBTQ plus Affirming Healthcare series. Equality Florida and Broward Health are dedicated to ensuring that LGBTQ plus Floridians are treated with dignity and respect in healthcare settings. That's why we're excited to announce a collaborative healthcare equity initiative designed to provide quality, informed, and affirming healthcare for the LGBTQ plus community. Through this partnership with Broward Health, comprehensive LGBTQ plus healthcare guidelines have been implemented with intention to support the community, and a series of community outreach awareness initiatives are planned over the next 2 years to bring these guidelines to life. We're also dedicated to doing the work to ensure that our partnership with Broward Health staff moves into the training space where everyone is trained and equipped to provide affirming healthcare experiences for all. We're so pleased today to have an amazing panel for you today, consisting of Milena Cedeno-Oblinger from Broward Health's Memory Disorder Clinic, Jerry Chasen, Director of Development at Sage Incorporated, and Victoria Didio, Program Manager at the Alzheimer's Association. I'm also so pleased to be co-facilitating with my good friend Barry Gallison from Broward Health, who has joined us. Barry, welcome. I'm so excited about our first launching series program. And let me toss it over to you for a few opening comments.
Great. Good afternoon, everybody. Just want to say happy Pride Month. We are thrilled to be partnered with Equality Florida, and they have been so supportive in our journey to maintain our commitment to our LGBTQ communities. We are sitting here in Fort Lauderdale, and we have a huge community, and we want to be able to make sure that they feel safe and have access to quality care. Broward Health offers services from beginning of life to end of life, and all those specialty services that we need in between. Today is a great program looking at successful aging in the LGBT community. We have exciting programs for the next 2 years, and we look forward to being able to better meet the needs of our community so everyone feels safe and can access the care that they need, so we can focus on prevention to keep people healthy. So thank you, Gina. It's a pleasure to work with you all at Equality Florida.
Thank you, Barry, and so well said. Maybe I'll kick it off by introducing our first speaker, and then you do the second speaker, and then I'll introduce the third. And then, Barry, you can wrap it up for us with some closing comments. We welcome everyone out there who is watching us live across the country. We encourage you to provide comments, ask questions in the chat, and we will try to pick those up with our amazing panel as we go forward. Let me first introduce you to Jerry Chasen. Jerry is the Director of Development at Sage, the country's largest and oldest organization dedicated to improving the lives of LGBTQ older people through programs, services, and advocacy. Headquartered in New York City, Sage is a national organization that has been looking out for LGBT elders since 1978. Jerry is the former principal of Miami-based Chasen and Associates, PA, a pioneering LGBT estate planning law firm. Through that firm, he created the Advisors Project, an ongoing CLE credentialed educational program designed to encourage and support various professional advisors in creating client relationships that are both satisfying and productive for philanthropy. In 2010, he left his practice and became vice president and later chief operating officer of the Alliance of Global Good, and was responsible for the organization's programs and communications. Trained and certified as a life coach, Jerry's coaching practice focused on the challenges of reinventing yourself and productivity for older adults looking at that next third stage of your life. Jerry's also served as a member of the national boards of directors at Lambda Legal, SAGE, before joining SAGE's staff. He founded and then chaired the Miami Foundation's LGBT Community Projects Fund committee for over 10 years. A longtime Floridian, Jerry is married to the fabulous, talented interior designer, Mark Kirby, and the parent to their four-legged child, Benny. Jerry, it is such an honor. You've been a busy person, and it's such an honor to have you as one of our panelists. With that, I will hand it over to you.
Thank you so much, Gina. I didn't realize that we were going to actually get all of that read. I apologize to everybody. You didn't necessarily need to hear the entire, my entire journey. I'm going to be 70 years old this year. And yeah, so it's been a while. There's an awful lot to talk about. But that's not why we're here. Thank you very much. I really appreciate the opportunity to be with everybody today and talk about some of the challenges that we as LGBT older adults have. At SAGE, one of the things I am most proud of is our skill in partnership. We work really well with other organizations. If there's a wheel that somebody's got rolling pretty nicely, we don't need to reinvent it to accomplish our goals. We are the LGBT voice in the aging community and the aging voice in the LGBT community. And on the subject of partnership, as I say, we work really well with other organizations, and perhaps none better than with Equality Florida. We have a very long and productive partnership, and I was so delighted, therefore, to get the invitation to participate with everybody today. When Renee invited me to do this, he said he wanted me to talk about general healthcare issues that impact seniors, and that's a pretty broad subject. So I asked, well, could we narrow this to what's different about getting older as an LGBT person, how Broward Health's cultural competency will determine whether people are comfortable enough to engage honestly, and what we at SAGE should be done generally. And he said, yep, that's exactly what I want to talk about. I want you to talk about. So that's what I'm going to talk about. So let's talk about these older people. I'd like to share my screen, Nick. Can we do that? Let's see, here we go. Give me a moment. I have a lot of buttons to push. That one. And if I'm lucky, you'll see what I'm seeing. There we go.
Perfect.
So again, as I started to say, let's talk about those older people. Now, everybody knows that this population is just getting bigger and bigger. Two things are happening simultaneously. There's an increase in lifespan and longevity, and the boomer generation was huge to start with, right? So in 2010, before the first boomer turned 65, only 13% of Americans were over that age. By 2030, when the last boomer turned 65, 1 in 5, 20% of Americans will be over 65. By 2034, more people will be over 65 than under 18. Let that sink in. By 2034, more people will be over 65 than under 18. So people are living longer, and a significant portion of the population is now coming into old age. Now that's true for the LGBT community as well. By 2030, we're looking at an estimated 7 million LGBT people in the United States over the age of 50. And in Florida, where the population of, the estimated population of LGBT people is 44.6%, we're looking at close to 900,000 LGBT Florida residents. And if you've spent any time in Broward County, well, you know that no small chunk of that almost 900,000 people live in Broward. So this is the quantity of people in this population, but I think it's really important, and you'll see why, that we look also at the quality of this population. This is the community that went from this, through this, to this. We went from Stonewall and what all preceded it through the AIDS epidemic, to marriage equality and what comes afterwards. It's a rather remarkable group of people, probably one of a kind, because this is the generation that came out of the closet, created relationships, created families of choice before it was possible to make any of that legal. People didn't necessarily go to have children within the context of their gay and lesbian relationships because, well, that just wasn't what was done. Now it's much more common when people can get married, and there are more people having children. So the journey that this community has taken has been pretty extraordinary. But it's not without its challenges, not without its consequences. This journey was no walk in the park. There's the impact of discrimination. Financially, it's huge. LGBT people have made far less money as a community than their heterosexual counterparts. The opportunities weren't there. For many people, especially the elders, when they were starting out their careers, if it became known that they were LGBT, they'd get fired. They would be dismissed. There would be no opportunity. They would be effectively shunned. But this also has shown up, the impact of discrimination has also shown up in self-esteem and self-care. There is a significantly higher percentage of LGBT people who are smokers. The same is true of alcohol abuse. So then we look at support networks. Remember that many LGBT people are estranged from their biological families. LGBT people are twice as likely to live alone and half as likely to be partnered. What does that lead to? It leads to chronic isolation. Living alone, especially if paired with any kind of health concerns, can aggravate social isolation. And much has been written about the feelings of loneliness that this engenders. Chronic isolation has been likened to the equivalent of smoking 15 cigarettes a day. That's how damaging it is to an individual's physical health. Another stat, LGBT people are 3 to 4 times less likely to have children. Who's the default caregiver in the United States? The child. So you're looking at people that are often alone, often isolated. So what do we do for support? Well, we look at creating networks of support, chosen family. But what happens so often with chosen family is that they are our peers, right? They are the same age that we are. What happens then? Well, when we age, so do they. When we need help, oftentimes so do they. Moreover, when that help is needed, it's often when we're older. And the consequence of that is caregiving is a particularly stressful experience. And oftentimes it happens when someone is least prepared to take it on. So then you'd say to me, well, okay, let's just work with professional caregivers. Why not? I mean, that's what they're there for. Well, not so fast. Remember that this community has transformed every institution of society that it has touched. But it's the oldest old now that are pressing into the elder care community. So they're often forced to be closeted in their presentation, forced to not be honest, not be candid in sharing the details of their physical well-being, of our physical well-being. So we delay care, and we don't necessarily go to get care. And then what happens is that these things start to inform one another. Discrimination leads to fear of rejection or worse, which leads to not seeking care, which leads to more disability, which leads to more isolation, which leads to more needing care, and so on, and the spiral continues. Now, one of the things that we know is that people are particularly concerned, focusing on that fear of discrimination. ARP did a study that Sage worked on with them. As an LGBT community member, if you or your spouse or partner ever needed long-term care, such as in-home assistance, assisted living, nursing home, home care, how concerned would you be about the following? More than 2/3 of the people said that they would be concerned about being neglected. Close to 2/3 said that they were concerned about being abused. 61% said verbal or physical harassment was something that they worried about. 61% also said that they were afraid that they would be refused or only got limited access to services. And more than half said that they were afraid that they would not be able to be out or would be forced to hide or deny their identity. Now, these are people who have risked a lot just to be out and be honest and to that last thing you might say, well, what's the big deal? Go back in the closet. It's like, no, that is the negation of everything that so many people have made true about their lives. But that same study, that AARP study, found that more than 80% of respondents would be more comfortable if caring communities took actions to intentionally affirm LGBT adults, which is, shout out to Broward Health for taking this journey. Now, one thing I want to, even though I know that Broward Health is not a religious organization, I need to point out that when you're looking at care and communities of care, a study that was done in 2016 revealed that 85% of nonprofit caring communities were religiously affiliated. Now, even though Broward Health is not religiously affiliated, the community may not perceive that distinction and lump all care providers together. So I think it's really important, and we at Sage do think it's really important, that there's an opportunity to distinguish amongst care providers, those where we would be welcome, those where there has been an investment in how do we engage this community, how do we make sure that this community feels welcome and appreciated within the services that we provide. And Sage has come up with two different ways of addressing it. The first is something we call the Long-Term Care Quality Index. And we worked on this together with the Human Rights Campaign. You may be familiar with the Human Rights Campaign's Corporate Equality Index. This is a sister to that, if you will, much newer. It's an assessment tool that supports residential long-term care communities in adopting policies and best practices that provide culturally competent and responsive care to LGBT older adults. Again, Broward Health is not a long-term care facility per se, the opportunity to distinguish itself from other care providers is an important thing in terms of using the Long-Term Care Quality Index. And one of the things that it looks at, what are the policies of the organization? How are they expressed? What kind of training is there? How do they engage not just their clients, but their staff as well? And in going through this, there's an opportunity to have the distinction of the ranking within the Long-Term Care Quality Index. And I'm very excited to say that this is a relatively new tool, and the first listing of organizations and rankings is coming out at the end of this month. Another thing that Sage has done is some training. I know that Equality Florida is working with Broward Health in their training. We also have Sage Care, which is a training program that is credentialed and allows organizations to specifically share the fact that they've had training by posting a credential, and the credentials vary, of course, depending upon the extent of the training that the organization has received. So in closing, I think it's important to acknowledge a few things. The first, it's a different experience to come into older age as an LGBT person than the population generally. The challenges, the journey that we've made has not been an easy one and has not been without consequence. The second is that there are opportunities and there are ways for different service providers to celebrate the fact that they have taken the step of sharing, learning, growing in a way that will allow them to serve the community in a culturally appropriate and affirming way. And shout out to Broward Health for having taken that step with our good friends at Equality Florida. Back to you, Barry. I think we're going next. Is that right?
Yes. Thank you, Jerry. That was very informative. It's my pleasure now to introduce Victoria Didio. Victoria is a program manager for the Alzheimer's Association and helpline specialist for the state of Florida, providing care and support and educational services to individuals living with Alzheimer's disease and other forms of dementia, as well as the family and friends of care partners. Victoria has a background in social work focusing on gerontology and has experience in case management and has worked with assisted living and memory care facilities. Victoria has dedicated her professional career to serving the aging population to ensure that they age with dignity and are provided with and maintain a good quality of life. Thank you, Victoria.
Hi, and thank you so much for having me today. And Jerry, what a wonderful presentation. I really took all that information to heart, and it's good to see that information. So thank you. So as mentioned, I am a program manager with the Alzheimer's Association. Here at the Alzheimer's Association, we are leading the way in research, trying to find an end to Alzheimer's and all other dementias. And we really want to have a focus on, and what we are trying our best to do is really to reach those underserved populations. So we want to get to those individuals who are diverse and underserved throughout their community. And we have most certainly recognized the LGBTQ community as one of those communities. And so we are making it a main focus to really get in partnership with our local resources here in Florida, such as SAGE. I know we work very closely with SAGE as well, and Equality Florida, and of course Broward Health here. So we are planning on, we actually are starting our LGBT Ideal Council, which really is trying to reach out to our local partners within the community so we can get that best feedback on learning how is it best that we're going to reach this community? How can we provide the information that they need through this aging process? How is it that we ensure that we're providing them with the best resources available out there? So again, where we can use SAGE in that regard, and making sure when I'm providing referral sources, I'm having that conversation with individuals and really getting to know them so that way I can make those correct referral sources. Whether or not it's for a home health agency that's going to be open and welcoming to our LGBT individuals, whether or not the assisted livings that they're looking into, that long-term care, making sure that those facilities have been trained and are welcoming of all individuals. Because it's, we want to make sure that this is an equal opportunity and that everyone feels at home and again can age with that dignity and not have that fear that they need to change who they are as they age, especially after all these years and struggles that they've gone through already. We want to ensure that they get the care and support that's so needed as they age. So again, we want to know that the Alzheimer's Association is a partner and ally within this community. And we want to ensure that you feel comfortable reaching out to us when you need that information, when you need those referrals. And again, caregiving can be a very difficult aspect. And like Jerry mentioned, many times it might be children or that same cohort that is providing that care. And so we want to just kind of take a look at how can we best serve this community and get the information and supportive services that are needed throughout this process. And so basically now I'm just going to go over a few warning signs of Alzheimer's disease and dementia. So that way it is common. So that way, if you see an individual that you're close to, a family member, a partner, a friend, someone that you just have a close relationship with, so to recognize those signs and symptoms, so that way you can reach out, you can be aware, and we can put you in connection with the resources that are needed. Don't believe I'm going to share my screen because I had a little difficulty earlier. So I'm just going to go ahead and talk. So here at the Alzheimer's Association, we have 10 main warning signs to look for. The first one is memory loss that disrupts our daily life. So we know as we age, we can become more forgetful. But so that is a kind of a normal aging process, just like other senses decrease, our sense of touch, our vision, taste. We do have other aspects that decrease as we age. And so memory can be part of that. When it disrupts our daily life is when it becomes a concern for us. So in that regard, we just want to make sure that our forgetfulness isn't impacting our daily functioning. And when it does, it is a cause for concern. Another sign can be challenges in planning or solving problems. So we see this a little bit more when individuals have difficulty solving those problems where let's relate it to like math. I know not everyone's a math person here, but when, let's say if you've always been a math person and then all of a sudden you can't even figure out a tip on a bill, or you're having trouble balancing your checkbook or functioning in the sense of, did I already pay that bill? I'm not sure if I did or not. So again, it's when we're put into situations where we have to problem solve and use our executive functioning. When our executive functioning starts to be concerned, it's time to get it checked out. Another one is difficulty completing familiar tasks. So some things we just do as second nature because we've done it so often. This could be like, again, we do forget. Let's say, we're cooking a dinner and it's something we've made every, week of our life as an adulthood. Once in a while when we go food shopping, it could be like, we forgot to pick something up because our minds were elsewhere, but we do realize it at some point of we forgot this ingredient and I need to go get it. This could be where you have all the ingredients, but you're forgetting that sequencing. You're not sure when to add what ingredient or completely forgetting. And at the end being like, this doesn't taste right, but I don't know why. So again, it's the completing those familiar tasks that become more difficult, kind of like sequencing. So even think about in your daily routines in the morning, we have our sequences of what we do. We might have our coffee, we go take a shower, we bathe, we groom, we get dressed. So maybe forgetting some of those steps can be a big sign. Our next one would be confusion with time or place. So again, especially throughout these last year or so, I know we've all had a little struggle with keeping track of our days and times, kind of what feels like Groundhog Day maybe. But this goes a little bit deeper than that. And, of course, there's those days. I think the other day was at a doctor's office and I had to put the date. He said, I had to ask someone next to me. I had to pull out my cell phone to be like, what is today's date? I can't remember what today's date is. But right, I was able to have enough knowledge to pull out my cell phone and look at the date. So, and again, we can be forgetful in those regards and it can become increasingly worse. This is more when you completely forget maybe that you had an appointment that day and you don't get a recalled memory that, oh no, I missed that appointment. Let me call and reschedule. This can be getting lost, going to familiar locations. Maybe you're going to Publix, and I don't know about you, but sometimes when I drive to Publix, I don't even remember the process it took, and all of a sudden I know I'm in the parking lot because it's so second nature to me. I know where it is. It's, easily. But where we might see a concern is maybe that individual who's been going to that same Publix for 20, 30 years, all of a sudden has in trouble getting to that Publix or getting back home. So again, this is really, the signs are really more about what's outside your norm. Again, we do want to keep that in the top of our mind as well. We can start to see trouble with understanding like visual images and spatial relationships. So this might be where we more see like more accidents in a car because maybe we didn't see that depth perception from, where that red light was, or really even understanding what those signs mean. As we know that Alzheimer's and dementia does affect our vision and how we interpret images. So some people might, as we age, we might get cataracts or changes in our vision, might need reading glasses. We go to the eye doctor, we get it checked out, and maybe, they'll tell us we have cataracts or we have a reason behind it. This could be none of those causes. It's just the way your brain is seeing those images. When working in memory care, I used to not be able to wear clothing with certain designs on it because I noticed it would really confuse those individuals because they didn't know what they were looking at. I definitely got poked a lot when I would wear something with different designs on it. So again, our vision can change due to Alzheimer's or dementia. Another big one that people might recognize right away is problems with our words or speaking and writing. Again, as we get older, our functioning might slow down a tad bit. We might forget words a little bit more often. I know I can be in the middle of a conversation and just stop and be like, oh, what was that word I was looking for? Maybe a few minutes later, maybe an hour later, that word's going to come back to my mind and say, that is what I was looking for. This is going into it a little bit deeper. This is more common that the words or in your speaking are being forgotten, more likely to lose that train of thought, and using more descriptive words because they might not be able to find the correct words. They might be looking to, ask you for a pen, but that word pen isn't there anymore. So they might say, I need something to write with. I need, the thing that you write with. So again, it's going to be more of those confusion with words, maybe not being able to recognize the correct word to use, or losing that train of thought a lot easier. Another one would be misplacing things, losing the ability to retrace your steps. Retracing our steps is really important. I know I put things down sometimes and I'm like, oh goodness, what did I do with that? But again, I'm going to go ahead and retrace my steps. When did I last have that? What did I do? My sequence. What was my sequence? And more often than not, I'm going to find that item. So this is when it comes down to not being able to retrace those steps. Might not remember that they went to Publix and then when they came home with the groceries, they put their car keys in the refrigerator accidentally when they were putting things away. To have that skill to be able to go back in their mind and say, okay, this is what I've done. So we'll see more here in that regard of people saying things are lost or stolen. Something got stolen or I can't even remember. I had one woman tell me a story where, she wasn't sure what was going on with her. And one of the main signs was she lost a pair of shoes that cost a lot of money to her. And she had no ability to retrace her steps as to where she left these shoes. She went and bought a whole nother pair. And a few days later, her husband came home and said, why would you leave these at the park? And she had no recollection of leaving her shoes at the park. So again, you can see where that's a little bit more than just I left something, in the wrong spot and I was able to retrace my steps. Coming close to the end. So number 8 would be decreased or poor judgment. So again, our judgment can sometimes slack a little bit. We might see like elderly individuals get scammed a little bit more often, right? We always have to make sure we educate on those scams that are out there nowadays. But so this can be even more so, not understanding that they were even scammed and giving their money being taken advantage of in that regard. But this can also coincide with their self in regard. We see it a lot with people maybe decreasing their hygiene practices. So might be saying, well, I took a shower yesterday. Maybe they did, maybe they didn't. But again, that personal hygiene of not taking care of themselves as much can be a sign. So if you're an individual who used to, take a shower every day, wash your hair every day, and then all of a sudden we see our loved one or individual not showering every day, not, brushing their teeth or combing their hair. So again, this decreased and poor judgment can have that personal effect on us. All right. And last two would be withdrawal from work and social activities and changes in mood and personality. So again, this can have different effects, and we have to keep in mind the person's original personality qualities. If this person's been an introvert their whole life and never really wanted to go to social outings, this might not be a sign. But if this person has always been out and about into social groups, and then all of a sudden we're seeing that withdrawal, that could be a sign that the individual might have some self-consciousness even. Maybe they're not having good conversation or can't seem to follow, so they want to back away from those individuals. And we can see personality behavior changes as well. So maybe someone who is always so kind or, easygoing might be more anxious or, maybe a little bit more aggression. And that can also stem from the inability to express oneself because we're not sure of that decreased judgment and self-awareness. So many times these signs and symptoms aren't always going to be seen by the individual. They're going to be seen by those closest to us and those around us. So it is important for us to keep that individual's personality in mind and keep a log. You see some things that are strange, jot it down. Keep track of it. If you see it in yourself, again, try to write it down, try to remember it. Because our biggest thing here is when in doubt, get it checked out. If you're seeing these changes, we want to rule out that it's medical issues, that other underlying medical issues that can be causing some of these changes. We just want to keep in mind that it's dementia and Alzheimer's is not a normal part of aging. It is a disease. And yes, we do change and our cognitive functions do change as we age, but the disease itself is not a normal part of aging. And yeah, that would be it. So it looks like we might have a question.
Yeah, awesome, Victoria. I have to say that alarmingly, I recognized at least 7 of those traits that you outlined, which is going to make me go check myself out soon. And I don't say that laughingly, but certainly I found my keys in the refrigerator the other day and really set off some alarm bells. But we do have a question from Todd Duppel asking, there has been some research on exercise and dementia. Can you speak to the importance of exercise when you're younger and middle age, and is there any correlation?
Yes, thank you. Thank you for that question. It is a great question. So yes, what we do see is that our heart health greatly impacts our brain health. So exercise is definitely part of a way to prevent possibility of developing Alzheimer's or a different form of dementia. So we do say that's one of the key pillars in our brain health. Exercise, nutrition, socialization, and cognitive exercise. So again, we know that our heart can greatly affect our brain. So if we're so cardiovascular disease can be a cause to Alzheimer's or dementia. So we know individuals for heart disease, diabetes, all of these are contributing factors. So it is important for us to keep our heart healthy so we can do our best to keep our brain healthy. So exercise is a great aspect of that. We try to say, if you've never been an exerciser, it's never too late to start. Start with 15 minutes a day, raise it up slowly until you can get to that half hour to an hour a day. We want to get that heart pumping so that way we get the blood and oxygen flowing to our brain as well.
Thank you for that. Let's take one more question before we go to our last panelist. And this is certainly near and dear to my heart. Dementia runs in my family. My grandfather and father both died of dementia. My father, Lewy body dementia, which was a very rapidly onsetting disease. Renee asks, how much does genetics play in Alzheimer's and dementia?
So we do know that genetics play a part. Unfortunately, I'm not able to say what the amount it is. We would say the greatest risk factor still to Alzheimer's and dementia is age. So over the age of 65, we know our chances do increase every 5 years of the possibility of developing Alzheimer's disease. Yes, there are tests where you can test your genes, but of course, I would refer you to your physician with these concerns. And we do encourage that individuals get those yearly brain screenings. So that way you can kind of know where your base is, and going forward, your physician can kind of follow that and make sure that there's no decrease in cognitive abilities. Because we do know that the earlier you catch it, maybe more manageable to going forward. So there's been great advancements in science recently. And so we do encourage individuals to be aware of your genes, be aware of your health conditions, be aware of your cognitive skills. So that way, as you go through your aging process, you are aware, you know what your levels are, and if there's changes throughout that. And like we said, if we want to always try to keep it, if we can catch it in that mild cognitive impairment stage, so where the medications might be able to intervene and maybe even slow down the progression at this time. So we are helpful.
Great. Victoria, thank you so much for all of that great information. Let me I'm so honored to introduce our third speaker, Milena Cedeno-Oblinger, RN, SCRN, CDP, memory disorders. She's from the Memory Disorder Center. She is a supervisor and a coordinator. Milena is the nursing supervisor and coordinator of the Memory Disorder Center at Broward Health North. Milena has worked in the field of heart and vascular nursing for 13 years, practicing in Southern California at the University of California, Irvine, and recently in Broward County. Milena is a certified dementia practitioner as well as stroke certified registered nurse. Her current role is coordinator of programs and services for the Broward Health North Memory Disorder Service, or Center. So it's an honor to introduce Milena Cedeno-Oblinger. Welcome.
Thank you. I'm really glad to be here. I think my job on this panel is just sort of sum it up with some action steps. We know that this population and even nationwide is aging. And so we know that these concerns are going to continue to be a critical aspect of how we provide care in the aging network. I know as a nurse, I can speak for the nursing community to say that it is a critical concern that we can recognize the effects of bias and that we can appreciate the importance of the terminology within the LGBTQ community. That we can understand diversity in the LGBTQ community. And I think that this will be key aspects of training for us. And that as nurses, we're advocates. We're advocates for our patients. We took an oath. And so we want to advocate for the inclusion of sexual orientation and gender identity.
Milena, let me interrupt you there briefly. We're getting a little feedback from your end. So if you could turn down the volume on your end, hopefully it'll fix that.
Okay, give me 1 second.
Oh, it sounded better just right there.
You know what? I took my phone off the hook and I wonder if that was interfering it. It was ringing. So I apologize if the phone rings, but if you can hear me better, we'll put it back on the hook.
Perfect. Thank you so much.
Do I have to start over?
No, go ahead. We've heard most of it. We just had some static mixed in there.
Okay, great. So I think what Pride Month sort of represents is that the LGBTQ community is resilient, okay? It's a resilient community, yet still at risk. So as the Memory Disorder Center, I'm going to share with you some of the experiences that we've had with our LGBTQ participants in our programs and services, and the areas that I kind of want to discuss and highlight today. Some of the services that we provide at the Memory Disorder Center are free memory screens. So Gina, you're welcome to stop by for a free memory screen. We can do that for you, and we can monitor that for you and let you know if there's area for concern or if we should just keep watching. We have support groups. Our support groups are very diverse, but they're very crucial to caregiving when it comes to Alzheimer's disease and dementia. We have caregiver workshops where we have our caregivers learn about the aspects of caregiving, very specific, very specialized to Alzheimer's disease and dementia. We do diagnostic evaluations, whether that's for the cognitive impairment or maybe driving. You know, public safety is really important to us. And we also provide counseling, and we can do referrals for clinical trials. So we know that the population is aging. So, you know, there are some things that we need to address. Planning for the future. So what we have experienced here at the Memory Disorder Center is, you know, making long-term care and end-of-life decisions is very emotional. It's very difficult. You know, we need to openly discuss these situations. And if possible, we need to ensure that we understand the individual's wishes for their end-of-life care. In addition to understanding their wishes, it's important to have legal documents in place. So what we've experienced specifically to the LGBTQ community is, you know, a legalized, recognized relationships, right? So if you're married or if you're not married, it needs to be addressed within the relationship that there's a legal document in place that you, the significant other, has the right to voice the wishes of your loved one. And so, you know, the LGBTQ community is especially vulnerable to the limitations in making decisions for each other legally when it comes to law. And it's important for you to complete advance directives. And there are two types of advance directives. One is a durable power of attorney for healthcare decisions. And the second is a living will. And the living will covers a lot more than just the healthcare decision durable power of attorney. But this is something that we discuss with our participants. You know, what is the plan for the future? Are there legal documents in place? Because when it comes to making decisions, they want you to make the decisions. You're the closest individual to them. You're their significant other. And so you need to know the local laws. You need to know the laws affecting the LGBTQ caregivers. And they differ from state to state. And seek legal assistance for complex situations or questions. Access to quality healthcare. The LGBTQ individuals may access routine healthcare less frequently than others. I think Jerry touched on this. You know, there's research out there that, you know, we're looking at, and that individuals have fear of inadequate treatment or discrimination. So I know Broward Health is going to be addressing this. We want to provide the training. We want to provide access to quality healthcare. You know, the research shows us that higher rates of disability, poor general health, mental distress, which is huge for memory disorder, mental health distress, as well as some adverse health behaviors such as smoking and excessive drinking, have been shown among sexual minority older adults, higher rates as compared to heterosexuals of their similar age. So this may be due to their outing, to their youth, to the discrimination. You know, we said that this community is resilient, but there's also been trauma there. And so this can leave mental health issues, depression, anxiety, which again plays a huge role on the memory as we age. Research has also found significantly higher rates, 9 out of 12 chronic conditions or multimorbidity. So chronic health conditions like heart disease, which we said, we have to manage. We have to manage heart disease because, again, it plays a huge role on what is going to happen with our memory and our thinking and our cognitive function as we age. But the multimorbidities and chronic conditions among sexually minority older adults compared to heterosexuals of similar age. So, although resilient, there's still huge risks there, and they have to be addressed with quality healthcare. Seek supportive healthcare providers who make you feel comfortable. You can fire a doctor, and you can find another one. And there's some great sources out there like the Gay and Lesbian Medical Association, which can help you and refer you to providers in your area. An LGBTQ community center in your area to find a provider who is sensitive to your concerns so that you can disclose the true problems that you're having and get quality health care based on those concerns. Finding support. Now, Jerry, you hit the nail on the head. Finding support is what we have experienced to be so critical and so devastating. For some LGBTQ individuals, a family of origin is not present, in their lives and cannot be relied on during difficult times. Can we rely on our peer who's aging with us, who's having their own chronic problems? This is a disparity that's happening. There's high rates of childlessness. And oftentimes the caregivers that we're working with are adult children caregivers, and this may not be available. And if this is true of your situation and you happen to be a caregiver who's listening today, it's important to find other sources of support as you face the demands of caregiving. We want resilient caregivers. We want your cup full so that you can provide a healthy care partnership. And that means you need to care for yourself and you need that support system as a caregiver. The LGBT National Senior Hotline is available for you. That number is 888-234-7243. And they're providing senior callers ages 50 and above with confidential peer support, information, local resources, and more. As well as our team here can provide, a care team, a team of a support network, support groups, and counseling. Disclosing your sexuality is very personal. It's a personal choice. And to whom and when you disclose this is your sexual orientation or your gender identity is very personal to you. The worry is real and it's relevant that service providers will not respond or will respond negatively to your LGBTQ identity. And so again, we need to find providers that you are comfortable with to disclose areas of concern, to disclose your sexuality, to be who you are, and still provide that quality health care. Early studies found that older adults did respond to sexual orientation and gender expression measures in aging and public health studies. And in one public survey of adults, including those ages 65 years and older, a sexuality identity question had a 98% response rate compared to a 10% response rate for the household income question. So I think that we want information. We want we want these problems and issues to be present and relevant, and we need them addressed. It's becoming critical now. And based on such evidence, public health and aging surveys in the United States are increasingly including sexual and gender identity measures. When you go to the hospital now, it's included on the assessment. You know, when you come to our office, it's included in the assessment because it's important to an individual plan of care. We're all individuals. And if we're going to develop an appropriate individual plan of care, we need to know who you are as an individual. So there are some great studies that continue to go on, and I encourage you, if you're a caregiver, to get involved with these caring and aging with pride studies, because it's going to be really critical to changing policy, to changing procedures that are happening within public health. I think that the NIH, the National Institutes of Health, the National Institutes of Aging, they have launched the Sexual and Gender Minority Research Office. They want to know. They want your feedback. They want your opinion. They want to know how to change public health policy to meet your needs, so that everybody can live well, everybody can live healthy. And that's our goal here as well at the Memory Disorder Center at Broward Health North. And I'd be happy to take any questions. I'm going to jump over to the comment section here. I'm sure there's some fabulous questions.
Yeah, Milena, let me segue. Mary Russ had a comment that we can put open to the entire panel, but she said basically it's important for families to educate themselves on coping with those who have memory loss and record as much conversation from them. So,
absolutely. I agree. You know, if we start early and we're in the mild stages, we can have great conversations about the journey that we're going to go on. And a lot of referrals that we get are the more moderate and critical stages. The people are, you know, these individuals are more severe. Our participants really can't get involved with that type of planning because it's progressed too far. So, you know, being able to recognize those warning signs that Victoria went over, and she did a great job really with the description of those warning signs, to seek an evaluation, because that the sooner we do that, the sooner we can start having those discussions and having those plans in place. It's always devastating to see the family fight, or, you know, to see individuals fight over what they think their loved one would have wanted or would have needed. And very much so in the LGBTQ community, when maybe family is not as close, but once that person gets to a place where they're at end of life, people come out of the woodworks and start making decisions and you know, start dictating and delegating things. And it's just not fair. It's not right. So I think having those legal documents in place, having those conversations sooner than later is critical to having a good journey through this disease process.
Very well said. Anything to add, Jerry or Victoria? Jerry, you're on mute.
Everything Melissa said is spot on. As a former, well, as my lengthy bio at the beginning said, I used to practice estate planning law, and saw too many situations where the planning didn't get done until it really needed to have been done. And you never want to say to somebody, it's too late, but oftentimes that was too late. You may remember, if you've been in South Florida for a while, you may remember years ago, there was a well-known photographer for one of the network news services locally. And he would fly in a helicopter, and the helicopter went down. And his partner of many, many years wanted to stay in their house. And his family drove down from Alabama with a truck and said thank you very much to the partner, moved the partner out, and wouldn't even leave him the dog that they shared together. So, you know, we don't hear those stories quite as often anymore, but there's no reason not to do that. You know, there's enough lawyers, there's enough legal services around heck, I mean, I would never have told anybody this before, but if you're really stuck, get some online thing and fill it out. But honestly, do not wait.
All right.
Do
Grief
not
makes people do silly and crazy things. And, you know, grieving is very challenging. It's very difficult. So, you know, have these things in place so that you're able to grieve, you know, when that time comes. And there's no discussion about what the wishes are.
And I'll just piggyback off of what these two great individuals said. It's so important for that early detection so that the individual can be part of the conversations, be part of that care planning for what they want for the future. Do they want to stay home and have that home care? Do they want to maybe look into the facilities and maybe pick their own? It's so important for us to be able, all of us, to be able to make our own wishes come true as we age and go through this. And it's important for caregivers, care partners to be involved in that discussion and have these conversations, know for sure what their wishes are. And for the caregiver themselves to become a master student of these diseases too. So that way they know how to best handle the situations moving forward.
All of those are such great points. I think all of us postpone, you know, making these tough decisions and recording information and getting a living will in place because we just don't want to cognizantly, you know, confirm that we're maybe there or a loved one is devolving into a dementia type state or something like that. I know that was the case with my dad, that it took us a long time for the family to really sit down and say, this is really something serious. It's not just a case of forgetfulness. So really, really great points. And a question came up, Barry, maybe I'll throw this one your way. Can you give us an idea of how Broward Health plans on ensuring that me and my care provider will be treated with respect and dignity?
Sure. Thank you, Gina. Broward Health is committed to improving the access points for all our patients. We are remodeling our intake forms, as Melina talked about, and our nursing assessments, and also in our patient registration to make patients feel more comfortable in sharing that information. We have partnered with Equality Florida and will be doing lots of training to make sure that the first point of contact persons are educated in sensitivity training in meeting these sensitive issues. So we are thrilled to start this education series and thrilled to start educating our staff to provide them with the opportunities to ask questions and explore and be able to meet the needs of our community. Thanks, Gina.
Thank you. Well said, my friend. A couple of announcements before we take final questions or have Barry close us out. Number one is tune in on August 12th. Our next LGBTQ Affirming Healthcare series will be on August 12th, same time, and we will be discussing affirming healthcare for our LGBTQ plus youth at that. So it should be super important, exciting, and certainly relevant with all of the, sadly, public policy that's been directed towards especially our transgender at-risk youth. So an important topic there. And then secondly, we want to invite everyone to join Equality Florida this Saturday for our Pulse Remembrance program. So look on social media or our Equality Florida site for that information. Panelists, amazing job, amazing information. We're getting comments that this is so relevant and so important, and your information has been just spot on. And I know I've learned a lot, and I know everyone tuning in has. So thank you on behalf of Equality Florida and Broward Health for all of your compassion in the work you do, but also being a part of this important panel today.
Thank you
so much, y'all. And with that, Barry, final comments.
Sure. I want to echo those sentiments from our partners at SAGE, Alzheimer's Association, and the Memories Disorder Center at Broward Health. We are so thrilled to have this conversation that's so needed. I also want to remind everybody that during COVID, it is safe to come to the hospital to get treatments, to get your screenings. We have safe protocols in place to make sure that the staff are safe and that you are safe. So please don't put off those memories screenings tests that Milena has offered and that Victoria has outlined. It's been a great panel that really has tied together the threads of making sure that we age with dignity and respect and get access to care that treats us with dignity and respect. So Gina, this has been a wonderful kickoff. We look forward to our next one on August 12th, talking about LGBTQ youth and the importance of healthcare, both mental health and physical health in that population. So thank you so much all for your participation.
Thank you.
Thank you.
Thank you, everybody. Have a great day.
Bye.